Hello, my name's Kaylee and I'm going to do a musculoskeletal assessment today. I would ask the patient if they have any history of joint disease or arthritis or any other joint or bone problems that I would like to know about before I conduct the assessment. After they answer these questions, I would start to move on to my assessment. The assessment is head to toe, so I would start all the way up in my head and I would start at the temporomandibular joint, palpate it, checking for any abnormalities or tenderness that they might feel. And then I'm going to ask them to open, close their mouth, and I'm going to ask them to move side to side. And I would ask them if they have any tenderness with doing all of that. So then I would move on to the neck. I would have the patient put their chin to their chest, and I would palpate each one of their cervical vertebrae. And I would test for range of motion, so I'd ask them to look up to the ceiling, chin back to their chest, look to their left and to their right, seeing if there's any tenderness with that as well. And then I'm going to test for strength. So I'm going to put my hand on the side of their cheek, and they're going to move their neck towards my hand against resistance. So both sides, we're going to do that, which I would see how their strength is in their neck. Then I would move on to the rest of the spine. So I would have them lean both sides and rotate their spine without rotating their hips. And then I would have the client I would have the client bend over, and I would check the curvature of their spine. When you are bent over, your curvature should be around a C shape, and when standing up, it protrudes out here and out here towards the sacrum. So it should be like a very slim S. I would then move on to the shoulders, palpating, testing for any abnormalities or tenderness that they may feel. And then I'm going to have them lift their shoulders up against my hands, up against resistance. And then I'm going to test for range of motion of the shoulders. So I'm going to have them put their hands at their sides and move their hands out laterally to go behind their head. So I'm going to go like this, and then back down, any pain or tenderness they may feel there. And then I'm going to have them go out in front of them and do the same thing. Any pain and tenderness there. So then we're going to move down to the elbows, and we're going to palpate each one, checking for any tenderness or abnormalities like everything else. And then we are going to flex the elbows, and then we are going to flex against resistance. So I would push pressure and have them flex against the pressure that I'm putting on their elbow. Okay, good. So we're going to do wrists now, and we are going to flex and unflex our wrists, and then we are going to pronate and supinate our wrists and our elbows. Any pain or tenderness there is not good. And then we're going to just do our fingers, so we go like this, and then we palpate our hands and our wrists to find any tenderness or abnormalities that we may feel. Alright, so now we are going to move on to the hips. So I'm going to palpate the hips for any tenderness or abnormalities. I'm going to have the patient pull out their leg as much as they can laterally. So we're going to go like this, and then do it the same way but out in front of us. Go like that and like that. Any pain or tenderness. And then we are going to have them flex their knees and internally and externally rotate, checking for range of motion in all of these. And then we're going to do the same thing with this same motion, but we're going to go against resistance. Alright, now we're going to move on to the knees. So for the knees, we are going to just flex them. We're gonna palpate the knees first, checking for any abnormalities or pain, which is good. And then we're going to put our leg out and flex it, checking for any difficulty doing that. And then we are going to hold the calf and flex our knee against resistance. Alright, and then we're just going to flex our knees up and out. Okay, and then we're going to do the feet. So for the feet, we are going to palpate for any tenderness or abnormalities again. The feet are also an important spot because they have many bones in the ankle and in the actual feet. So then we are going to push down and up against resistance. So we're going to push up like this and down like this on both sides. Alright, and then we're going to push out and in. So we're going to go like this and that, this and that. And then we're going to put our toes together, and then we're going to put our heels together. Alright, and that's all for the range of motion musculoskeletal assessment.